But I've always thought the smartest person in the room is the economist, just because there's so many different principles and events in the world that somehow have an economics root to it. And one of the best ways to win a debate is if you know what's happening in the world. So my name is Nuha Bazeer. I am an economic analyst with the Health Foundation, and I work for the Real Centre, which is the research and economic analyst for the long term. So I work on quite a few analytical projects, and the way that we do that is we combine a variety of data sets to answer questions within health policy. I studied economics for my undergraduate degree, and for one of my final year modules, I chose healthcare economics. I knew I wanted to go and do further study later on, so I chose to get some work experience in the meantime. So I worked for a medcoms agency first. That gave me some experience with pharma companies, and I wanted to work in the NHS, so I got some experience working with healthcare data. And after that, I did my master's in health policy planning and financing, and that was with the London School of Economics and the London School of Hygiene and Tropical Medicine. So that gave me a lot of exposure to kind of different areas of health policy, how we might finance it, what kind of difficulties we might come across when it comes to like navigating health policy and how to get policymakers to do things that are in the interest of their population. I applied for this job soon after I finished my master's and I got it. And yeah, I've been with the Health Foundation for over a year now. Economics and health sometimes are thought to be kind of opposites, in that we often hear that there's a false dichotomy between the two, but actually you need both. So we know that health is an area where you have kind of unlimited demand. You're always going to have people that need healthcare, and they're going to need different types of healthcare. But you have very limited supply, whether that's money, the money that you put into your healthcare budget, whether that's the number of doctors and nurses you have, even the number of hospitals and hospital beds. So economics, in terms of the principle of marrying supply and demand, when it comes to healthcare, is very difficult because of this imbalance between the demand and supply. We also know that it's really important to be able to project how your healthcare population might change over time. So if we can already carry out analysis that tells us X many people will be living with chronic conditions like diabetes or cardiovascular disease, then we can change the way that we train our staff, or kind of how we can prevent these problems come exacerbating in the future. One of the ways I got into economics when I was younger was I did a lot of public speaking and debating. And one of the best ways to win a debate is if you know what's happening in the world. You might have been hearing a lot about kind of a change in the cost of living or energy bills, and really try to understand and apply what that means to you and how these things can change people's approaches to their daily life. And I think if you can apply economics, you get rid of the fear that some people have that it's a very technical subject that you need to read and be really good at maths to do it. But I've always thought the smartest person in the room is the economist, just because there's so many different principles and events in the world that somehow have an economics root to it. So even if you're thinking about current affairs, like what's happening today in terms of European politics, everything has kind of a connection back to the economy and how different countries might, win or have an advantage depending on what actions they take in terms of their foreign policy. If you've chosen it and you've studied it and you found yourself in a job that actually maybe isn't really your interest, it's really easy to pivot away and use your knowledge of economic theory to find a new opportunity. So it just offers you a lot of versatility that perhaps other careers don't.